There are six things that a surgeon should think about when looking at a new job position. The first is, where are you going to operate? A lot of contracts say you're going to work wherever we send you. The contract should provide each facility where you're expected to operate, and you shouldn't be added any more without your concurrence. The other thing is, when do you operate? There should be OR blocks. So it shouldn't just be you see some patients, run over to the hospital, do a procedure, run back to see some patients. Obviously, you're not going to be very effective that way. The other thing you have to worry about is, when do you start? A lot of contracts require 100% credentialing before you can begin. The contract should allow for some negotiation if not all of the payers have credentialed you before you begin. Another thing you always have to worry about is tail insurance. When you leave, are you going to have to buy a very expensive tail to cover your malpractice? Always have to worry about a covenant not to compete. When you leave this job, are you going to have to move out of the area, maybe take your kids out of school? So you have to make sure the covenant not to compete is reasonable, and it shouldn't apply if they terminate you without cause. And I think the last thing to worry about is, if it's a private practice, there should be a discussion of ownership. Maybe you're not guaranteed ownership, but it should talk about when you're going to be offered ownership, what criteria they're going to use, and a methodology for determining a purchase price. If you'd like more tips, please follow me on pahealthlaw.com.